We're in the surge right now. When you saw those images of New York City, that's where we are in Springfield. The grass is green and the birds are chirping, and it doesn't feel that way to most people. But if you walk inside the hospital and then walk inside our COVID ICU units, you'll know that we're here. Time bought us the ability to add capacity. You know, we built this 51-bed COVID ICU. We prayed we'd never use it. We were ridiculed by some. It is like a war zone there now. It is packed. When we hear someone died and we say underlying conditions, that's beginning to be a point of concern for me, because I think people begin to believe that's because they have some kind of super compromised immune system. The most prevalent underlying condition is obesity, followed by hypertension and prediabetes. Those are all really associated, and I suspect more than 2/3 of our population are suffering from those issues right now. So when you hear underlying condition, understand that it's a sort of thing we're all fighting in terms of staying healthy. Visiting our unit, I saw a young patient, 40-year-old patient that looked to be about 70, but when I saw a picture of that patient 2 weeks prior, they looked to be about 35. I asked, is that patient on paralytics, because they're clearly paralyzed? They said, no, this patient's not on paralytics, that's what the disease does. The patient had this reflexive bending of their back toward the ceiling, as if they were a paralyzed person reaching for the surface of the water to get oxygen. It's a really horrible thing to see when these patients are really suffering and really, really struggling. I look at my job principally right now to protect our staff. It's our staff that protect our community, and if I don't protect them, they can't serve our community. And I'll be honest, I'm failing at that. We've lost an employee, and that's powerful for us inside healthcare. We have deep worries about the respiratory season. When we overlay the patients that we normally expect in a high flu season, we have an additional 30 patients per day. Masks are not perfect. They're helpful. And I would argue if they're 50% helpful or 20% or 70% helpful, that saves lives. And looking this further, I remind you that we are in an island of masking, surrounded by a sea of those that don't. Our hospital is filled with people from that sea. Our unit is filled with people that don't believe in this disease, and it's filled with people that have been very careful, and they've been exposed to disease often by those that don't believe in it. And you become believers, obviously, once you get in that unit, and we feel it's our obligation and duty to share what we know. So it's been our philosophy to reveal this beast, to share what we know, not to create fear, but to create the background information I would want to have if I was a general member of the community and understand what's going on. So that's been a little bit of our philosophy, to reveal this monster so we know how to address it and know how to defeat it.